I'm really grateful for you giving us a chance to educate you on some healthy eating habits, on healthy lifestyle. And before now diving in the world of obesity through the lens of science, I would also like to prepare your brain a little bit because you need oxygen. So please stand again. And what you will do is raise your hands and take a deep breath, yes? Like this. And then exhale. And we do 5 times, like again, set. Yes. 2, 3. 4. 5. And don't forget to upload yourself. Okay? Good, thank you. So now, before I start this, I would like to challenge a little bit of some things I heard today and to give 2 questions to you. So one challenge is, what do you think? Are the people of Asian descendants, as you, has a different level to measure obesity or not, compared to Caucasians and even Africans? What do you think? Is there a difference or not? Who thinks that is the difference? Please raise the hands. Okay, not many of you, but actually there is difference. When we said that obesity starts from body mass index 30, in Asian people it starts from body mass index 27.5. Know this. So your body mass index already at the lower, it starts already obesity. 1, 2, I heard that you said there is weight loss medications, and said that weight loss medications is Ozempic. It's not true. Ozempic is medication to treat what disease? Diabetes. But you're right in this, that the substance that is in Ozempic, the substance is semaglutide. The substance is also used to treat obesity. But the medication that is used to treat obesity with the substance semaglutide is called Wegovy. So when we say Ozempic, it's like became a generic name for treating for medications, but it's not true. So always, if you think about this, look for the true medications. Yes, everything you need to understand it has to be true. So this is about challenging. Now 2 questions. One question is, can you raise the hands? Those of you who think that obesity is a disease, or this is a lack of willpower. So those who think that this is a disease, please raise their hands. Okay. Good. And those who think that obesity is a lack of willpower, please raise the disease. Okay. Half of you. Great. So now today, my talk is to convince at least half of you that this is a disease. And actually, obesity is a disease. World Health Organization recognized obesity as a disease in the year 2000. So it's already 25 years is recognized obesity as a disease. Why is it important for us to understand that obesity is a disease? Because obesity, as other chronic diseases, like for instance diabetes or hypertension or whatever, 1, needs treatment, but 2, can relapse without treatment. Yes? That's why we are getting back our weight. And then the last question is, before my lecture, why is that difficult to lose the weight and maintain the lost weight, especially maintain. Because to lose the weight, okay, somehow we can, but maintain the lost weight is difficult. Why do you think is it? Lack of willpower. These are those who think that this is willpower. But I can say to you, as an argument against saying that obesity, 60 to 70% of obesity is in our genes. The problem is that like 1,000, 3,000, 5,000 years ago, there was no possibility for our genes to get expression at this level. Why? There were not that much food. We were struggling as a humans to survive, to get the food. So, we need to eat to survive. And our body is made that way that as soon as we see a lot of food, we eat it, accumulate, because we don't know what will be happening tomorrow. In our days now, we know what will be happening because we will go to supermarket hungry again and buy a lot of food and sit in the evening, watch TV. But imagine, 100 years ago, it was not like this. And we have the genes. Now we have not changed our genes. Yes, in the last 50 years when we got supermarkets, we have not changed our genes. So we started accumulating food, fat, as a human. So now, okay, I asked to my slides, yes, with you, okay. So that's one slide a little bit back. Just about me, I'm professor in surgery, one slide back, and one more, just introduction slide. Yes. I'm a professor of surgery in two universities, Gothenburg University, Sweden, and Lithuanian University of Health Science. And I founded this like a line of North weight loss clinics. Why? Because I have seen that we need to have a scientific approach to what is done. Because people are doing and trying a lot of different things, and finally they do not succeed. But there are ways to succeed. But this we need to personalize. And what my colleagues have been talking, again and Maggie before, this is right. And I will go now to the what are the causes. Now, please, second slide. Already Dr. Mari, in his introduction, mentioned that we currently have like epidemic of obesity. And it started from somewhere 70s, 60s, 70s. I think with this consumption culture, supermarket culture, overproduction, and so on. But not the least, I think personally, that this is started also by the food industry. Because they started putting a lot of sugar in different products. And sugar stimulates our hunger sensation. I know from myself. When my wife, she buys to me a healthy bread, I cannot eat. I eat one slice of bread. When she buys a bread, where there is sugar in the bread, I want to eat it continuously. And if I have not drawn the slide like this, but there is a very nice correlation between consumption of sugar in the world and rising rates of obesity. These two curves go parallel. And believe me, the consumption of sugar in the world is going like this. And this is also one of the reasons why we have these problems. Why obesity is also going, and it is on the rise, and extremely on the rise. I mean, during last, from 1975 to 2025, so if we take all these years, so the number of obesity in the world has tripled, 3 times increased. Okay, next slide. So body mass classification, this is usually how we estimate our body mass index. We take our height, we take square of our height by meters, and then we take our kilograms. So we divide our kilograms by our height in square meters, and we get our body mass index. But But as I said, this is a general classification, but for Asian population, you have to decrease all this by 2.5 units. So obesity already starts from 27.5, and second grade obesity from 32.5, and the third grade starts from 37.5. Next slide. So, but is it really our body mass index can measure obesity? Because we have people, yes, like athletes, that have more muscles. So this is not only body mass index that is important also fat distribution. Because sometimes we can have a low body mass index, but we have a big belly. And according to body mass index, maybe we will not be ranked as obese, but if we measure our waist circumference, we'll find out that this is already increased high risk for all the diseases, because fat inside our belly increases the risk of diseases, such as diseases as diabetes, hypertension, myocardial infarction, lipids in the blood. Next slide. Next slide, please. And this is also to illustrate, there was a scientific study that has done on people who has the same body mass index, 24. And they found that this is MRI, and they found that there is like 4 times big difference in the amount of fat from the lean individual to the other who has a lot of fat inside for the same body mass index. So when also you are thinking about your health, you have not only to measure this, but also to measure your waist circumference. Okay, next please. So what is the problem with visceral fat? I already mentioned that this visceral fat accumulates in our liver, so we get fatty liver. It accumulates around the pancreas. It accumulates also in skeletal muscles. And we are usually, when it accumulates, the so-called metabolic syndrome starts, where I told already before. This starts diabetes, hypertension, there is high lipid levels in the blood. And this is further leads to other consequences, yes, to your health. Next, please. So, but what about these guys? Yes, these are like sumo wrestlers, have you know? Yes, have you heard about them? They are intentionally eating a lot. Why? Because otherwise, if you will be thin, they will push you out of the circle. Yes, there is no chance for you. So what do you think? Are they healthy or not? No? Yes? Why? They have muscles, yes. Second. Why they get muscles? Because they train a lot, yes. They are, in other words, they are fit. Next slide. So it was a very nice study done on 25,000 men. And what was found, that individuals who were fit and obese, they were equally healthy to individuals who are fit and non-obese. But individuals who has low fitness and obese, they have 3 times higher risk of getting all these diseases. So even if we have some overweight or some obesity, if we exercise, we can maintain our fitness. So fitness is very important. It's not only for losing the weight. Actually, with the exercises, it's very difficult to lose the weight. Why? Because you have to exercise a lot. A lot. Because currently, for instance, I'm running like 5-6 kilometers per day. I'm spending 500 kilocalories. And now many say, okay, it's very healthy to have a handful of the nuts. But you know how much calories is in a handful of the nuts? And 100 grams of nuts is 600 kilocalories. So I run 6 kilometers, I have taken 100 grams of nuts, it disappears. All my exercises, yes, all my efforts. So that means that by doing exercises, you will not lose the weight. You can lose the weight by adjusting your diet. But why exercise is important? Yes, for your health, but also for maintaining the lost weight, because it gives you structure, eating and so on. So this is important to exercise, for sure. Next slide. So now I said you also about the growing prevalence of obesity. This is a picture just to illustrate for you, in one decade, in United States, how changed the prevalence of obesity. That means that in 1991, there were states with some light blue colors. That means that less than 10% of people had obesity. And you see, in 10 years' time, disappeared light blue colors. There was only dark blue and already started dark orange. That means more than 25 prevalence. So see how rapidly an explosion of obesity is happening. Okay, next please. And even worse, we have problems about children and adolescents. And this is the same have been seen as in adults. For instance, in 1975, the prevalence of obesity among children and adolescents in the world was 1%. After 40 years, the prevalence is about 6 to 8%. And we can see why. For instance, with our lifestyle, when I was growing, I was playing outside. Currently, the kids, when they are growing, they're playing inside with the computers connected with their friends, and they're playing the games. And what you do when you play with the computer, you snack. So everything is coming like a circle, and it's becoming a bigger health problem. Next one. So how it looks like, for instance, Kenya, if we look at the prevalence of obesity? Yes, it's much less by now. I think that's why I say by now, because still, it's even in Kenya, like in Western world, this is overweight and obesity is increasing. So we know it's maybe 4 times less, like 6%, but still there is growing numbers. And this, as I said, if we consider this as a chronic disease, and soon I'll tell why, so we have to take care of this and educate the people. Next slide. So, when we say that the main cause of obesity is simple, yes, this is how much of the calories we take in and how much we spend. And what is the difference? This is left with us. So the cause is simple, but the treatment is not that simple. Please go on. So, what are the factors causing obesity? So there are a lot, but as I said, 60 to 70% is the genes. But also, there are socioeconomic, cultural, and psychological medical factors. So from socioeconomic factors, I mentioned also all these culture that we have, that we consume more and more energy, sugar, and so on. And this is also in the family eating traditions, also plays a role. And also our work, that we come back after work tired and we start eating in the evening. What we have talked today, that we have to take 3 meals and 2 snacks. Me personally, I don't know. Not that often. I eat in the morning and eat in the evening, but in the evening I try not to eat too much. This is the only way how I can control my weight. Because if you start eating in the evening, why is bad eating in the evening? Because during the day you consume the energy. Actually, our brain is working on the sugar. The fuel for our brain is the sugar, nothing else. Not the proteins, not fat, it's only sugar. So 50% of our calories, for instance, during the day are used by the brain. But during night, if we eat a lot, we consume not that much. And the fat, and then when we have too much of the sugar is converted to the fat. But then the next day, to extract calories from the fat is not that easy. You have to work a lot. So it's better to have also, like we have mentioned, light dinner, even if you have not been eating too much during the day, because otherwise you are on the wrong path. Please, next slide. So why I'm saying that this is in the genes? There were good studies. There are monozygotic twins. That means the twins that they have the same genes. And there are dizygotic twins where the twins have two different genes. And when they looked at monozygotic genes who share the environment, living in the same place, having the same genes, they're similar. But when you have dizygotic twins, when they share the environment, but they don't share genes, they're different. One could have problems with obesity and the other not. So that means there are a lot of things in the genes, but not in the environment. Please go on. But also environment plays a role. Yes, in 1916, when the people were going to the cinema, they were taking a very small can of Coca-Cola. But now, people are taking a lot. And popcorn, they were taking only 174 calories. And now people take like 2,000 calories. 2,000 is that big, like this is about 1,700 calories. And we normally need about 2,000 kilocalories per day with that activities that we have. Yes, please go on. I'll concentrate not too much, but definitely our psychological situation, our emotions also play a lot. And also there are diseases and medications that also make that the people gain weight and get more of the appetite. Okay? Please go on. So, despite that the cause of obesity is pretty simple, that we take in calories, we have to spend calories, the obesity itself is a complex problem. And why is, please next, why is not good living with obesity? Why is not good? Because you see, obesity is, and Dr. Vanik have shown the picture, obesity is associated with a lot of diseases. But if we look particularly, for instance, to diabetes, so men with body mass index 35 and above, and an Asian population 32.5, they have from 8 to 20 times higher risk to get a diabetes. For women, this is about 5%. But also atherosclerosis, hypertension, dyspnea, back pain, next slide. But even cancer, mortality from cancer is increased more than 1.5 times for those who have body mass index over 35. So generally we can say, okay, it does not matter if I have obesity or not. Yes, I would say it does not matter if you are fit, yes, but if you are not fit, it matters a lot. And in majority, with time, we are not really fit. We don't have that much time to exercise. Next slide. So, why also it's important, if we look at time perspective, so when somebody at 24 years, or 20 years, sorry, has body mass index of 24 and has 44, so they are losing about from 6 to 20 years of their life. And this is a lot to consider. Okay, next slide. And even the cost increases. I mean, living with obesity increases the cost of medications, treating the diseases, and so on. So, and the cost is increased by 30 to 50%. Especially in the systems that do not provide a good public care, so that this cost goes also on the individual. Okay, next. So what about the treatment? So we started already talking, so if you look at the science, so what is presently and currently available? Yes, this is the diet, and here you have to reduce the calories. And it's according to your body mass index. You reduce either 500 kilocalories or 1,000 in order to lose the weight. Also exercising. But from the treatment, and we talked already about this, so I will concentrate a little bit more on other treatments like currently available pharmacological treatment that means injectable medications that we talked about, Mounjaro or Wegovy. And I will concentrate later on a little bit on surgery and non-surgical treatment methods. Yes, please go on. So this is a complex slide, so I'm sorry for this. I thought we will have a huge screen that you will see like in the conferences, but I'm sorry for doing the slides that are a little bit more complex. So, but what this slide tells for us, that this is in perspective, and the perspective of, this is, it's not clearly, but 5 years, this is 3 years, this is 2 years. And this is 0, this is plus, this is minus kilograms. So this is something with a combination of diet, exercise, changing your eating behaviors. We land somewhere about 5 kilograms on average if we are really looking after these treatment methods. We land in this weight loss in the range of about minus 5 kilograms. Because at the end of the day, when we are talking about obesity, we are talking about weight loss, yes? And majority, I don't know if I'm already exceeding the time. It's okay. So it's a little bit about the surgery. I don't know. Who of you have heard something about weight loss surgery? Can you raise the hand? Okay, only a few. Good. So this is something new to you, but it's not exactly new. Weight loss surgery in the world is done 70 years. 70 years. Maybe in Kenya, yes, less. We started, and I was coming also for the workshops maybe 10 years ago. We started doing more, but still there are different surgical procedures. But two main procedures are so-called gastric bypass. What Mike already introduced you, we are creating a small stomach connecting to the small bowel. And the food is bypassing the lunch stomach. Yes? So that's why it's bypass, gastric bypass. And the other is gastric sleeve, where we're creating a stomach like a sleeve, yes, like our sleeve. That is like banana shape that is going down. So in both cases, we're reducing the stomach, size of the stomach. At some point, there were bands that we were like lines above which we recommend doing surgery. So definitely there are agreements that this body mass index 35, and for Asian population 32.5, with comorbidities. It could be diabetes, hypertension, hyperlipidemia, that metabolic syndrome, but also sleep apnea. The infertility for young women is one of the reasons also why and if they are obese, why it's recommended to go for weight loss surgery. And also if there is BMI over 40 or BMI over 37.5 for Asian population, without any comorbidities, I've already recommended to do a surgery, but there is, second slide, but there are some prerequisite conditions. We have to evaluate that there is no endocrine diseases, but from my practice I can say that majority of obesity is because of calorie overtake. And it's like 99.5% or whatever. But still we have to look for hypothyroidism and Cushing syndrome. And also it's very important psychological stability, because the patients must be committed to our follow-ups, to keeping with the recommendations of eating and so on. So this is also not only just going to Turkey and getting getting surgery done there and coming back and thinking that, okay, I will live with this. But this is also needs some commitment and follow-up afterwards. Okay, please. Next slide. So one interesting study, and why surgery? I was working, and I'm still working in Gastric University. And one study that has been done there is very famous in the world. It's the only study that is following the patients who had surgery and were paired with those who had no surgery. And this is like 2,000 pairs, 2,000 individuals that had surgery, and the other pair side had no surgery. And they were paired according to the body mass index, to the diseases, and so on. And this study already following them, next slide, and this study already following them 20 years. 20 years. You can imagine prospective study where you're checking 4,000 individuals, how is going to them yearly. And what they found that in the control group, there was no decrease, despite that they got all diet advices, physical activity advices, and so on. There was no decrease in the weight in 20 years. But in surgical group, especially gastric bypass group, what we can see that there is a decrease in total body weight in about 25%, even after 20 years. So that means that with the surgical procedures, it's possible to lose the weight, it's possible to regain the weight for sure, but it's possible also easier to maintain the lost weight and the long term up to 20 years. So that's why with the data from this study, the surgery started increasing by 3 to 4 years as control to those who had no surgery and they are living with obesity. So that means with doing surgery and losing the weight, people may regain their lost years of life. Another, also reduce remission of diabetes, and that people don't need to take medications, while conservative treatment do not allow to do this. Next slide. And also cancer mortality, especially among the women, because studies have shown also that there is about 25% decreased risk in cancer mortality after weight loss surgery as compared by living with obesity. Okay, next one. So why patients do not choose surgery? The patients, in majority of cases, those who need surgery, they do not choose surgery because they are afraid of complications. And they do not know side effects, what should await them. That's why it's one of the reasons why you have to choose a specialized centers where the risk of complications is really low after doing a surgery, and also that you have follow-up and possibility to address the side effects if they will come after surgery. Next slide. And if we are talking about mortality, current mortality after weight loss surgery is very low in these people. Yes? We think, as part of us, we think that this is a lack of will of power. What does it mean? He has to go to the gym, train a lot, eat less, and he'll be happy. But if we think back what I told you, that 60-70% is in the genes. So that means that it's not possible for everybody to do this. And even with our life and our occupation, to do this is very difficult. Next. So as a bariatric community, what goals we have? For sure, we have one of our goals is to educate and to talk to the people like you, and I'm really grateful for your community today, listening to us and getting some information that maybe will change your understanding about obesity and the obese people that are around you, that they actually need support from us, yes, because this is a disease. Next one. And definitely it could happen that the shape of the things to come, this is a cover of very famous economist journal, we have somewhere to try to overcome this. Yes, be it with medications, lifestyle, diet, treating, but we need to change this pattern that we are on. And last one, and this is the last one, and this is what you have been told about our clinic here in Kenya, that we're looking for innovative, personalized care, and we are collecting all this under one roof to help for the patient journey. So thank you very much for listening.